So we're trying to raise some money for a new procedure called photodynamic diagnosis, but better known as blue light cystoscopy. This is a treatment that helps patients with bladder cancer. We instill a chemical into the bladder through a fine tube called a catheter and leave that soaking in the bladder for about an hour. The chemical is taken up more readily by abnormal and particularly cancer cells in the bladder, so that then when we look into the bladder with a special camera equipped with a blue light, the areas that are abnormal shine more brightly and are easier for us to identify. This helps us to remove cancerous growths from the bladder more fully and to identify some areas that we might otherwise have missed. If a patient's been found to have abnormal cells in their urine on microscope testing, it can also help us to identify what's caused those abnormal cells and how we can best treat them. It's not a procedure that every patient with bladder cancer needs, but it will help us to provide more accurate and thorough care for a selected group of patients who will benefit the most. One of the other things we're fundraising for this year is a system called TURIS. It uses a different form of electrical current with a more modern form of telescope to allow us to trim back prostate tissue to create a more open channel for patients to pass urine through, and can even be used to trim away bladder tumours inside the bladder. It's an updated version of an old-fashioned piece of equipment, but because of the way the electricity runs through and around the telescope, it can help to reduce the risk of some of the common side effects of this form of surgery and can help to control bleeding better, meaning that patients are able to get home from hospital faster if their case is routine, or allowing us to take on and treat patients who have larger prostates who otherwise couldn't be treated in our hospital.